I am Ilyka Fe V Paña from BSN 111F Group 24, and for today I am going to perform the thorax and lungs assessment. So the purpose of having this assessment is for us healthcare professionals to note the presence of abnormalities, particularly with regards to the thorax and lungs of the patient, and for the doctors or any specialist to have it addressed. Now, the first thing that we're going to do when we're going to have this assessment is for us to review the client's previous medical records or doctor orders or doctor sheets only if available. After that, we are going to prepare our equipment. So I have here the gloves. So the purpose of it is for our patients to avoid being embarrassed whenever we touch the anterior or their posterior chest wall. Okay, after that we also have our stethoscope. So this is for the auscultation or auscultating. We have here our paper and pen for us to jot down our observation, and we also have here our marker and ruler later for the diaphragmatic excursion. Okay, so without further ado, let's hop right into the assessment. Hi ma'am, good morning.
Hello, good morning.
Okay, so let me introduce myself. I am Ilyka Fe V Paña, and I will be your nurse for today. Can you tell me what's your name?
I'm Isabel V. Paña.
You're Isabel V. Paña. How old are you?
21 years old.
So you are 21 years old. What's your birthday?
November 19, 1999.
November 19, 1999. Okay, so what do you want me to call you during the assessment?
Mom, I
Ma'am Ira. Okay, noted. I'm going to inform you that we are going to be having our thorax and lung assessment today, okay? But before that, or before we proceed with the assessment, will you want me to close the door and the curtains for your privacy?
Sure.
Okay. Do you feel good? Okay. Okay, is the temperature enough for you? Is that
Yes.
okay? So first I'm gonna be explaining to you what are we going to do for today, okay? So the first thing that I want to tell you is I'm gonna be doing a procedure, okay, to check for your to check the status or the condition of your posterior and anterior thorax, okay? So I'm also gonna be asking you some questions during the assessment, okay, if that would be okay with you. And I hope that you'll cooperate, okay, and rest assured that what we did today or the assessment that we're gonna be having today will remain confidential, okay, to protect your need, okay, or for your privacy. Okay, do you have any questions or any clarifications?
Oh, wala.
Wala. Okay. So I think this assessment will took you for an hour. Okay. That's it. Okay, so let's start the assessment. Okay, so the first thing that we're going to do when we are going to have this thorax and lung assessment is to position our client where we can observe clearly the posterior thorax of the patient. So sit down. Okay. That's good. Okay, so after that, we are now going to start for assessing the posterior thorax of the patient. So by the way, this assessment following a sequence, and that is inspection, palpation, percussion, and auscultation. So the first thing that we're going to do is to inspect, no, okay, for the respiratory mechanism of the patient, if the posture of the patient, okay, like that. We're also going to inspect that. So basically, it's just surveying the chest and the respiration of the patient. Okay, if the nose of the patient are flaring, if the patient has a pursed lips when breathing, okay. So we're just going to observe, okay, with the use of our clinical eyes. Okay, just relax, inhale, exhale, just relax. Okay, so the purpose of this procedure is for us to know if there are signs of respiratory distress that we could assess, okay? And of course, to have it addressed. So after that, we are gonna proceed with examining the posterior thorax and lungs of the patient. So, okay, inspecting. We're going to inspect the symmetry of the scapula of the patient. Okay. We're also gonna be palpating the suprasternal notch. Okay, right over here at the base of the neck of the patient. Okay. Like that. Okay. So what we're doing is inspecting for configuration. Okay. So the next thing that we're going to do is to inspect for the spinal alignment. So we are going to ask our patient to please stand up like that, and we are going to be positioning ourselves on the lateral side of the patient. So for us to check the curvature of the spine. So there are three parts of the spinal cord of the patient: the cervical, the thoracic, and the lumbar, and the most bottom part is the sacral. So the cervical is the top part, the middle part is the thoracic, and then the bottom part is the lumbar. So we are going to inspect now the alignment. So ma'am, can you please bend slightly forward? Okay, just the waist level. Okay, and then we're going to position ourselves behind the client, like that, to check for the alignment of the spine. Okay. Okay. Thank you so much. So the purpose of it is for us to know if there are any deformities present when it comes to the spinal alignment of the patient. You know, if the patient has a scoliosis and all that. Okay, so ma'am, go back, sit down. Okay. Now we are going to proceed with palpating the posterior thorax of the patient. So we are going to position our fingernails. So and we are by the way, this is the left side of the patient, and this is the right side of the patient. Okay, so we are going to place our finger, the palmar surface, or the palm surface of our fingers on the apices of the lungs. Okay, okay. Going to ask the patient if she can feel any tenderness or we can feel any masses. Okay, ma'am. Okay, does it hurt here? Okay, how about here? Okay, so our sequence will start from the left, moving across to the right and going downwards. How about right here, ma'am? Feel any pain? Right here. How about right here?
Wala.
How about right here?
None.
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 Right here?
None.
How about right here?
None.
Right here?
None.
How about right here?
None.
Okay. So the purpose of doing this procedure is for us to know if there are any abnormalities that we could assess, and also for us to know if there's a presence of pain on certain areas of the posterior thorax of the patient. Now let's proceed with palpating the posterior thorax for the thoracic expansion. So we are going to place both of our hand on the level or on the base of the lungs, and it's just the level of the T8 or T10 I think. Okay, okay, and then we're going to ask our patient to deep breathly. Okay, okay, ma'am, inhale. Okay, just inhale, just breathe deeply. Okay, inhale, exhale, inhale, exhale, inhale, exhale. Okay, so that as you can see, it's normal, right? Because the normal thing here is that when the patient inhales, our thumb should move away from each other for about 3 to 5 centimeters, and when the patient exhales, it should go back to its original position. So why are we doing this procedure? So this is for us to know if the lungs of the patient is expanding normally when inhaling and contracting normally when exhaling. Okay, after that, we are now going to proceed with palpating the posterior thorax for vocal fremitus. So fremitus is the perceptive vibrations that we can feel as an examiner when the patient speaks. So we are again going to place our palm, the ball of our hand right over here, because this is the part of our hand that is sensitive with when it comes to vibrations. Okay, so again we are going to start on the left and going moving across the right, going downwards. Okay, so we're going to start with the apices of the lungs. Okay, on the left scapula. Okay, ma'am. Can you say blue moon?
Blue moon.
Again.
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 Blue moon.
Okay, so the purpose of that procedure is for us to know the symmetry and the intensity of the vibrations, okay, while the patient is speaking. After that, we're going to proceed with the percussion of the posterior thorax. Okay, so what are we going to do here is that we are first going to start on the left side of the patient, moving across the right, and then going downwards on the patient's 8 to 10 ribs, okay? So we are going to place our non-dominant hand, okay? And then we're going to use our dominant hand to tap it, okay? Going to first start on the apices of our lungs, of our both shoulders, okay? Okay. Just relax. And now we are going to move on the intercostal spaces, okay, going downwards. Also, let's not forget the axilla part, okay, right over here. Okay, another one. Okay, so the purpose of doing this procedure is for us to know or determine the underlying tissues there. If it's either filled with air or fluid. So basically, it's just for us to measure the lung density of the patient. Now let's start with measuring the diaphragmatic excursion of the patient. So we are going to ask our patient to exhale forcefully and to hold it in while we are going to percuss for the resonance and the part which we can hear the dullness, okay? So we are going to be using our marker here. Okay. Okay, ma'am, can you please exhale? Exhale, exhale. Exhale, okay, and hold it in. Exhale, hold it in, okay? We're going to assess here. 6th rib, okay? Okay. Okay, ma'am, inhale and hold it in for a while. Let's percuss until we hear the dullness. Okay. Okay, so what we did on the left side, we're going to do it on the right side. Okay, exhale, exhale, hold it in. Okay. Okay. Right over here. Okay, inhale. Hold it in. Okay. So after that, we're going to measure it with the use of our ruler, and it should result to 3 to 5 centimeter as a normal, but for well-conditioned person, it's 7 to 8 centimeters. Okay. Okay. All right. So why are we doing this procedure? So the purpose of this procedure is for us to know the movement of the diaphragm during breathing of the patient. Okay. Now let's start with the auscultating for the breath sounds. Okay. So for this procedure, we are going to be using our stethoscope. Okay. Don't forget to open it like this. Okay, so We are again going to start on the left, the apices of the lungs, and we're going to start on the left apex of the lungs, moving across the right apex of the lungs, moving downwards. Okay, inhale, just relax. Inhale, exhale. Okay. Okay. Inhale. Inhale, exhale. Okay. Just relax. Inhale, exhale. Okay. 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 Inhale, exhale. Okay. Inhale, exhale. And to proceed on the axilla part. Okay. Okay, inhale, exhale. Okay, so the purpose of auscultating for breath sounds is for us to know if there are abnormal breath sounds that we'll hear during the inhalation and expiration process of the patient. So normally, when it comes to the lung fields, it should the vesicular breath sound is present, and on the mainstream, okay, of the bronchi, it should be the bronchovesicular breath sounds. Okay, so after that, we're now going to proceed with auscultating for the voice sounds. Now, there are three ways. We have the bronchophony, the egophony, and the whispered pectoriloquy. Okay, so now we are going to perform only one, which is the egophony. So we're going to ask the patient to say letter E, and then we are also going to be following a sequence, okay, of placing our diaphragm of our stethoscope. Okay? Okay, let's say letter E.
E.
Okay, one more.
E.
Okay.
E.
Okay.
E. 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 E.
Okay. That's all for the posterior thorax, and now we are going to proceed with assessing the anterior thorax of the patients. Okay, so by the way, the egophony, when we are when we're having our stethoscope, we should hear the E, although it's not that clear, but we can distinguish it. That is letter E, or the patient is saying letter E. When it comes to the bronchophony, the patient will say 99, although it's not it can be heard, or we can hear it, but undistinguishable. Okay, after that, when it comes to the whispered pectoriloquy, excuse me, so it should the patient will say the word 1, 2, 3. She just have to whisper it, and it should be inaudible. Okay. Okay, so now we're going to face our patient in front, okay, to check for the anterior thorax. Okay. Okay, so the first thing that we're going to do is, of course, inspection. Okay, same of what we did on the posterior thorax. Let's check for the if the patient is having difficulty when breathing. Okay, so ma'am, just relax. Okay, let's also observe the movement of the chest of the patient. Okay, just like that. Okay, so while doing that, we are also going to look, okay, for the color of the skin of the face of the patient, the shape of the chest, if it is barrel or pigeon or funnel, okay, because that belongs to the abnormalities. Okay, so okay. So again, the purpose of that is for us to note any abnormalities. Okay, when it comes to the respiratory rate of the patient. Okay, So after that, we're now going to proceed with the palpation of the anterior thorax of the patient. So what we did, again, we are going to start. So this is the left side of the patient. This is the right side. So we're going to start on the left by placing our fingers on the left clavicle, moving across the right clavicle, going downwards. Okay. So ma'am, do you feel any pain?
Wala.
How about here? How about here? Right here? Right here? How about here? Okay, right here? Right here? How about here? Okay, how about here? Okay. Can I please move your breast? Allow me like that. Can you feel any pain in here? How about in here? None? Okay, so the purpose of that procedure is for us to know if there are tenderness or any masses, okay? And while doing that, I am also observing for the vibration or the fremitus, okay, of the anterior thorax of the patient. Now, let's proceed with palpating the anterior thorax for respiratory excursion. So we're going to place both of our hands on the xiphoid process, okay, which is below the sternum of the patient. So right over here, allow me to insert my thumb, okay, right over here, okay, okay, breathe deeply, exhale, inhale, exhale, just relax, inhale, just relax, exhale, okay, so the purpose of it is for us to know if the movement or the expansion of the patient's lung is normal, because the normal should be that our thumb, when the patient exhale, our thumb should move away from each other, which is 3 to 5 centimeters away. And when the patient exhales, our thumb should go back to its original position. Okay? So after that, we are now going to percuss the anterior thorax of our patients. Okay? So we are now going to start on the left clavicle again. So this is the apex of the lungs. Okay? 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 The clavicle part. Okay. Okay, does it hurt or not? Does it hurt?
Hurt.
Okay, when I palpated, inside, does it hurt or not? Not? Okay. We're right here. Allow me. Okay, we're right here. Okay, sorry. Okay. So the purpose of this procedure is for us to know if the underlying tissues there are either filled with, again, air or fluid, okay? So that is to check for the lung density of the patient. So after that, we are now going to auscultate for the breath sound, or if there are any available adventitious sounds, okay? And also the voice sounds, okay? So again, we're now going to start on the upper or above the left clavicle of the patient, moving again across the right, and then going downwards, okay? Okay, just inhale and exhale, okay? Okay. Just sit up straight, okay? I want you to sit up straight. Okay, about here. Okay. Okay. Okay, we're right here. Okay, we're right here. Okay, so the purpose of doing that procedure is for us to know the sound or the airflow of the air into the lungs that passes through the lungs. Okay, sorry. Okay, so the normal sounds that we should hear is that on this part, okay, I'm going to auscultate, okay, okay, just breathe normally, okay, okay. Okay, so the normal sound should be on this part. It should be the bronchi breath sound, okay, and it should mostly hurt on the trachea. And on the vesicular breath sound, it should be heard on the lung fields, and then the bronchovesicular sound, it should be heard on the mainstream of the bronchi. So since we are done with the assessment, we are now going to discuss with our patient the result of our thorax and lung assessment. Okay, so ma'am, can you please go back to your original position? Okay. So now I'm going to discuss with you the result of our assessment, okay? So when it comes to the inspection, when I inspected the configuration, okay, of your posterior thorax. Let's start first with the posterior thorax, okay? Your scapulae are symmetric, and your shoulders and also scapulae are equal in position, so that's good. Your spine are vertically aligned, so you don't have any you don't have to worry about that. Your skin is intact, okay, as well as your chest wall. And as what you've said a while ago, there's no tenderness, and I've also assessed that there are no masses, so that's great, that's good. Okay, so also when it comes to your thoracic expansion, okay, your lung expansion, there's a full and symmetric thorax expansion, okay, and I've measured it. It's between 3 to 5 centimeter during your deep inspiration, so that's normal. And when it comes to your vocal fremitus, there is a bilateral symmetry of vocal fremitus, okay, and also fremitus was was mostly felt on the apex of the lungs, okay, so that's great. The when it comes to the percussion, or when percuss, the resonance, the lowest point, okay, of the resonance, the diaphragm was felt at the level of your 8th to 10th rib, so that's great, okay. And the distance between is just 3 to 5 centimeters, so that's good. When I've also auscultated for breath sounds, vesicular breath sounds are mostly heard on your lung fields, and bronchovesicular was heard on the mainstream of your bronchi, so that's good, that's great. Okay, and when it comes to the anterior thorax, okay, the front part, okay, your respiratory rate is normal. It's 18 cycles per minute. When you breathe, it's effortless and quiet, so that's a normal thing also. And your costal angle is less than 90 degrees, so that is great, okay. When I've also palpated it for any masses or any tenderness, there is no masses or tenderness present, okay. After that, we're not done, okay. We are now going to proceed with the movement of my tongue, okay. When it comes to the diaphragmatic excursion, okay, it's normal. It's 3 to 5 centimeter in distance. I've noted there's a resonance on your 6th rib at the level of your diaphragm, and then the dullness on your heart, okay, which is normal. And when I've also auscultated for the breath sound or voice sounds, the vesicular breath sounds are observed on your lung fields, which is good. Excuse me. And bronchovesicular breath sound was heard on the mainstream of your bronchi, so that's good. And then the bronchial breath sound was heard over your trachea, so that is also normal. I just would like you to continue that, and I hope you will going to live your healthy lifestyle. And I want to thank you for cooperating in this assessment. Thank you so much. I do really appreciate that, and I do hope you'll do well, okay, in your life. And thank you so much for thank you so much for participating. That would be all, and I hope you learned something from this video.